Thank you. I think we are moving from a good morning to good afternoon. So good afternoon, everyone. I want to start with something personal. As Paul mentioned, I have a professional identity. So I'm a consultant psychiatrist. I have been a health professional for last over 30 years. Of that, around 25 years, I have been working with people with intellectual disability. And that forms my professional identity. But more importantly, my other identity, that of parent carer, that has the most impact on what I do. What I mean, I have a son. I have a son who is 14-year-old. He's got learning disability or intellectual disability. He's also autistic. He's got a lot of other health conditions. He's got other neurodevelopmental conditions. And what that has done, that over the last 14 years, it has made me acutely aware of the factors that lead to health inequalities, the factors that contribute to poor health and well-being. And I think I want to look at that before we start looking at positive actions or solutions in that respect. I think I have become acutely aware of problem of science and scientific methodologies. I have become aware of political discourse and how that affects health and well-being, where we have to justify needs, where we have to be deserving to meet our needs. So social discourse has become quite problematic at the moment when it comes to disabilities. I have become aware of difficulty in accessing help and how one has to meet certain threshold where any help could be available. So that early help, the problems that one needs to solve on day-to-day basis, that help is not there. Of course, professionals are there to help, but you have to reach certain threshold to get that help as well. I have become aware of determinants of health, the social determinants of health, things that we take granted for, going to restaurant, going on holidays as a family, inviting guests to house, going to people's house. The things that are actually related with health and well-being are not always easily accessible when you are a parent carer of someone who is autistic, has developmental delays, and a number of other issues. So we know that there are a lot of factors that lead to health inequalities in this group of people. And of course, attaining health and well-being can be challenging for that individual and for that family. A good colleague of mine, Professor Sarah Ryan, recently published a book about 6 months ago, Critical Health and Learning Disabilities, an exploration of erasure and social murder. Look it up, it's very good. She discusses 3 concepts in that book. She talks about structural violence, she talks about erasure, and she talks about social murder. Structural violence is about our structures, our systems, political, economic, social, health system. When they cause harm, whether it's intentional or unintentional, in this case it is unintentional harm, that's structural violence. And when we look at people with intellectual disability, you can see how the structures are stacked against them. Erasure. Actually what matters, or the realities of lives of people with intellectual disability are often excluded, misrepresented, or diminished in some respect, or are invisible when it comes to our social, healthcare, cultural, and political systems. That's erasure. Social murder, powerful concept. There is a review taking place last 10 years looking into the mortality of people with intellectual disability, and they try to look at the avoidable causes of death. So we know a lot about why people with intellectual disability die much younger than general population, but nothing has changed to make an impact on the health inequalities or the health inequalities gap between those with intellectual disability and that of general population. That's social murder. When we know the causes of avoidable deaths, but we as a society, as healthcare system, not doing anything about it, that becomes social murder. Powerful concepts. And then one starts wondering, are health inequalities inevitable? Are we ever going to achieve that dream of health and well-being when it comes to people with intellectual disability? Something for us to think about. No, I'm not saying it's inevitable unless we continue to be bystanders. If we take positive actions, then we can effect change. But to think about those positive actions, let's think about why there is a problem. The society is created with or structured with able-minded people in mind. Able-minded and able-bodied people in mind. And some will go on saying, more so, able-minded men and able-bodied men from that perspective. So as a person with intellectual disability, his families, and those professionals working with them, they are always doing a catch-up. They are always trying to adapt to the system that has been created with someone else in mind. Then we land up adapting theoretical frameworks. We land up borrowing treatment modalities. Adapted cognitive behavior therapy, for example, for people with intellectual disability to address their problems. We borrow research methodologies and try to apply. We create structures that are not suitable, and then we try to do reasonable adaptation. What's reasonable adaptation? Reasonable for whom? It's such a subjective term that it is subject to interpretation and variation in interpretation based on social political discourses and based on economic realities. So it's not really real adaptation, reasonable adaptation. It's reasonable for someone, or it's used to justify not doing anything. So we have a problem there in terms of that able-minded, able-bodied society where we land up borrowing things and adapting things. The other problem is that of standardization. If you work in the NHS, the buzzwords will be standardizing practices, key performance indicators, we need efficiency, we need effectiveness. All very good. We will talk about Toyota model, lean management. Well, we are not creating cars here to standardize actually car production. We are dealing with people, and people are diverse. People are neurodiverse. So when we standardize too much, it can cause actually problems, especially for those who are on the margin. Something to keep in mind. The third problem is that of social media and changing culture and social discourse. I mean, this Twitter and all those things, what is happening there is rage baiting. But things that we were taking granted for are being challenged. Human rights were meant to be for humans, not for deserving humans, not for humans who actually meet certain criteria or member of certain group or has qualifying characteristic. So that discourse has changed. I was thinking about the wokeness, or the argument around wokeness. Being woke, it's looked at so negatively in certain sections of the society. The word wokeness or woke came from actually being aware, actively aware of racial prejudices, racial injustices, and then expanded to include all prejudices and all injustices. But now it has been used as a dismissive term. Oh, that's just woke. Oh, that's just left-wing nonsense. That actually leads to problems when it comes to advocacy for people with disabilities, advocacy for people with intellectual disability, because it becomes easy to dismiss it. Oh, it's just political correctness gone mad, it's just woke. So there are a few problems that we are looking at. So what do we do? Resilience. Creating a resilient society is important. The resilient society is of those who are resilient individuals. Now, the definition of resilience is like, ability of an individual to adapt to adversity and stress and achieve positive outcome in spite of those. That definition is a little bit problematic because it puts emphasis more on the individuals, its individual's ability. Here we are talking about people with intellectual disability. Socio-ecological point of view, a better definition of resilience is the interaction between an individual and that individual's social system that positively deals with adversity. Because that gives us an idea as to what we can do to create that resilient society for people with intellectual disability. What we can do there is to create that positive system that collaborates with that individual, positive social system. How do we create positive social system? Well, we need to actually work on stigma. We need to work on acceptance, because then it leads to actually proper engagement and community participation for people with intellectual disability. That creates the scaffolding for those with intellectual disability to deal with adversity. So it's important for us to create that scaffolding. It leads to inclusion. I think inclusion is very, very important, because when people with intellectual disability feels included, that's going to improve their health and well-being, because they are going to be a meaningful part of the society. So we do need to look at it, resilience, from that point of view. We need to embrace heterogeneity. And there are a lot of students here, professionals here, academics here. When we are doing our research, when we are developing services, when we are creating new structures and systems and processes, we need to keep the neurodiversity at the center of it, not as an afterthought. If we keep that at the center of it, then what we are creating, what we are developing, it's not adaptation, but it is actually creating something bespoke. Whether it is methodology in terms of research, whether we are actually doing a new service development, if we are building a new structure, keep the neurodiversity at the center. Think about it, what I'm doing, is that going to actually exclude people from accessing certain things? I think that's the important part. So embrace neurodiversity. To do that, we have to understand the perspective of that wider population. And the best way to understand the perspectives is to co-create and co-produce. Unless we do co-creation and co-production, we are not going to understand the perspective of that wider neurodiverse population. Co-creation and co-production allows us to change the power balance to that of partnership, to that of equality. It helps us understand perspectives better. It enriches the product that comes out. It makes sure that that product that is coming out is relevant to people for whom it matters most. But it allows us to move from adaptation to inclusion, but more so from inclusion to belonging. And that's what we should be striving for, belonging. Because inclusion is just about changing structure so that the person is at the table. Belonging is changing culture where the person feels they belong at the table. And that's what we are striving for. And finally, if nothing else, be woke. There's nothing wrong in being woke, whatever the social media says, because the alternative is to be bystanders to social murder, being bystander to eraser, being bystander to structural violence. And I don't think that's appropriate. I don't think any one of you want to be that. So be woke. As Margaret Mead says, and I think I'm paraphrasing here, that a small group of thoughtful, committed people can change the world. So let's be that change. Let's change the world. Thank you.